So I always like to start by explaining where I grew up and sort of, how my formative years, because I think that that's important, just as important as what I do for paid work now. So I knew from a young age that I wanted to work in the field of healthcare. And the reason for that is I was inspired by my grandparents who really were trailblazers. And I really want to just underscore the significance and importance of my grandparents shaping me and influencing me, because for their generation at that time, there were so few Black Americans who were in these more professional roles. So my grandfather was an orthopedic surgeon. He trained at Howard University and then established a multi-specialty practice in the Bay Area where my father and his sisters grew up. My grandmother was a bachelor's educated nurse. My grandmother was the first Black woman to graduate from the University of Washington School of Nursing, and that was in the late 40s. She reared her children. She worked as an office manager for my grandfather's practice. And then later in her life, in her 50s, she decided it was her turn, and she went back to school and got her master's in public health from Berkeley. So these two people, who I was very, very close to, spent lots of time with when I was younger, really shaped me and molded me. So I graduated from Churchill, and I started at Harvard I was on the pre-med track, because at that time I was pretty sure that my interest in healthcare would translate into me being a doctor. So I started on the pre-med track, and I figured out halfway through college that medicine was not for me. I was very interested in continuing to do something in health, but I realized that for me personally, the right way to engage in healthcare was to work more in an administrative capacity or policy capacity. So that is something just, healthcare consistent, slight pivot in terms of how I've applied that interest. So one thing that I was very sure about at the beginning of college, and which was consistent through the 4 years of college, is I loved Spanish. So I studied Spanish all through high school. I did the Landon and Summer program in Santander and Cantabria the summer before my senior year of high school. And I came into Harvard having waived out of the language requirement because I took AP Spanish, but I was so passionate about Spanish that I really wanted to take it. And in thinking about my major and how I would satisfy those credits, what I needed to do for pre-med, there wasn't as much room for Spanish, and I realized if I'm that passionate about it, maybe this is something I should just major in. And I did. So I was actually a Spanish literature and language major, and that was something that I unwavered. It was the right decision, right call for me. I'm very glad that I was able to do that intensive language study while I was in college. So how did things shift, and how did I realize I didn't want to be a doctor and that there was this other pathway in health for me? So the big thing for me was internship experiences, and I'm happy to talk more about how you think about that, especially as you all are potentially doing internship experiences now. And for those of you, I don't know if are there any seniors in the room? Not yet, juniors? So yeah, so as you all are kind of gearing up for college and thinking about that, I'm happy to talk about some of my decision making around that. But for me, I had an opportunity to intern at Children's National Medical Center here twice, the summer after my freshman year of college and the summer after my sophomore year of college. And I was working for, at the time, this woman, Jacqueline Bowens, who was the vice president of the Government Affairs Division. She had underneath her the functions that are trying to figure out how you interface with DC, Maryland, and Virginia government, because that's important for how Children's operates. She also oversaw volunteer services at the hospital, their community partnerships, a whole range of functions. And so for me, I was able to see and appreciate and understand, you have all of these health functions that have nothing to do with direct patient care. So that sort of, I think, started to get the wheels turning in my head. And then the second summer I came back and interned for Jacqueline again. And what really, I think, was the push for me to go into public health instead of practicing and going into medicine was I had an opportunity to do some shifts with pediatric emergency medicine doctors and pediatricians who were practicing in primary care clinics. And the things I loved the most about my time with those doctors was actually the additional time as the intern, just shadowing, that I could sit down and talk to the families. The doctor was already out of the room and on to the next patient. And so as I was thinking about what do I like the most about my internship experiences, I realized that as an intern, I was afforded additional time with the families and with these children that I would not have as a practicing doctor. So that sort of solidified for me that I have this passion. I want to have impact. I want to try and do it on a population scale. And so maybe I should think about public health as a field and think about population health focus instead of individual one-on-one patient interactions. So I had another internship going into my senior year of college where I worked at a policy organization out in California, lived with my parents who are close to Berkeley. That was awesome. And then I worked at essentially doing healthcare consulting for 2 years after I finished my undergrad degree. I went back and got my master's in public health from the University of North Carolina. Go Heels. If anyone has any North Carolina ties, if you have Duke ties, I'm sorry. So I did that. And then I came back to the DC area in 2008, so about 16 years ago. I thought I was going to do a short-term, try out policy, work on Capitol Hill, because I was really interested having this grounding in health and the field of public health. I really wanted to better understand how does this policy landscape that we talk about at the federal level influence individual behaviors and specifically making it easier for people to, be healthier, or what are some of the barriers to people achieving optimal health status. So I really thought I was going to work on Capitol Hill for a year or 2 years and then move on with my life. But here's how something changed. I fell in love with politics. So I was not somebody that was super politically engaged when I was in high school. I was not politically engaged when I was in college. I have a good friend who was the president of the Harvard College Democrats. He would have to bribe us to come out to events. So I was not into this until very later in life. And what I have ultimately realized that for me personally, I am very passionate, interested in jobs where I get to work at the intersection of health policy, thinking about politics, and then thinking about what I would call people development. So I like managing people. I like teaching people. So for me, when I get to work at the nexus of those three things, that is a good fit for me. And I wouldn't have known that about myself, or I didn't know that about myself when I was sitting in your shoes, and here I am years later. So I at GW currently, and I'm happy to talk more about my work at the Department of Health and Human Services. I worked, as was noted, I was a Chief of Staff to Senator Warren. I also spent time working in the House of Representatives for now retired Congressman Henry Waxman, who's considered a legend in healthcare. He's from Southern California. But importantly, the committee I worked for under Henry Waxman was the primary committee of jurisdiction in healthcare when we wrote and passed the Affordable Care Act. So I had a front row seat in my mid-20s working on the Affordable Care Act before I went on to work at HHS, and then later as Senator Warren's chief of staff. And then I came back and did the transition effort from the Trump administration to the Biden administration, then served at the beginning of the Biden administration again at HHS. So now I am at the George Washington School of Public Health, and I have essentially two functions. One, I get to teach undergraduates and graduates. So going back to what I said about I love people. I love developing people, helping people figure out what they want to do and guiding them in that pathway. And then the other hat I wear is I'm the policy director for a project called the Accountable Communities for Health Project, and we work with 9 foundations. And my job there is to really make sure that our funders understand the political landscape and the policy landscape so that they can think about how their private sector investments can best sort of expand, force multiply, complement what's happening in the federal government. So that's me. So again, I think healthcare has always been in my blood, but getting to this place of working at higher levels of politics, getting to be a teacher, getting to be a manager, not what I set out to do, but I'm really grateful for my journey and how I've gotten.
I know this may sound very broad and general question, but what was your experience with the COVID-19 pandemic, or specifically handling all the misinformation about the vaccines and such?
So let me just to ground where I was in COVID. So, it was very interesting. The timing for me at the start of the pandemic was interesting for a few reasons. So first, Senator Warren suspended her presidential campaign March of 2020. So our office was going through a pretty substantial transition because Senator Warren was out of the presidential campaign, returning to the Senate. She had a robust campaign staff, and we're trying to make sure that when we think in totality about all of these staff that work for Senator Warren, that they all end up okay, right? And figuring out who's going where in terms of who might be coming back to the Senate, who's being supported and finding jobs elsewhere. So there was a lot going on just with that transition at that time. I also mentioned I have a 5th grader and 2nd grader. You can do math. My kids at the time were 3 and 6, so that was a very interesting time for me as a parent to do virtual school. So I, from the beginning of COVID, what we were really focused on, since I was still chief of staff at that time, we had to figure out how our staff would move to telework. The Senate before did not have a telework environment or any sort of policy. Not everyone had a work issued computer, so there was a lot of just, again, going back to the management oversight of operations, a lot of like very tactical and specific things that we had to figure out very quickly and on the fly, and it was unprecedented. And then from a constituent perspective, we were really focused on making sure that Massachusetts constituents had information as Congress moved to approve different funding, whether it was housing, whether it was childcare, whether it was loans if you were a small business. We wanted to make sure that our constituents clearly understood what was available to them and how to access it. So that was one of the big things that we were trying to get at. Now, when I was at HHS, because I went back into HHS at the beginning of 2021, you know, a lot of what we were trying to do at that time was to be very clear that the science was sound in the development of the vaccines, that they were well tested, and that they were out there. And I think the importance of having clear and consistent messaging across different federal officials was very important for that, and really leaning into the benefits that we saw from vaccination in terms of minimizing the risk for getting sick or dying from COVID. Now, one of the lessons that we learned during the pandemic is it's really important, this is just, I think, an important life lesson, it's really important to be clear about what you know and what you don't know and how things might change. And so one of the lessons that we learned, we came out too strong in saying, you know, the vaccines are going to prevent you from getting COVID. We learned that's not true, right? So it took us months to figure that out, but being so definitive on the fact that you won't get COVID if you get the vaccine then opened us up for more criticism as we had the Delta surge in the summer of 2021 and saw the virus getting around vaccine, though it did minimize the risk for more serious illness and for death, right? So I think that is a key lesson, and that I would just, again, underline this, being like as transparent as you can with information, being as, you know, timely as you can with information, but acknowledging uncertainty. And if you don't know something, say I don't know, because that is better than you giving wrong information and then someone then you losing credibility.
Very thankful.
What was your most meaningful career experience?
Okay, I got 2. Both happened when I was working as then at the time counselor to HHS Secretary Sylvia Burwell. So this was at the end of the Obama-Biden administration. So the period of time I'm talking about is the end of 2014 through January 19th, 2017. So 2 things that happened there that were super cool. One, I had an opportunity to do what's called a recognition photo with the president. So every month, what President Obama would do is they would, through like a nomination process by the department that you were working at, they would nominate people that had done exceptional work in the previous month, and then you would have an opportunity to go to the White House and go into the Oval Office with the president. So I had an opportunity to go into the Oval Office where it was just me, President Obama, and a photographer, and I got to talk to him for like 10 minutes. So that was like hands down coolest experience of my life. Second coolest, also in this time period, I was working on the Zika response. This was during 2016. Was pretty interesting about this is a virus where we were very concerned about birth defects and risks, particularly for women and birthing people. And I was pregnant with my daughter. So I was doing all this while pregnant, which is a whole other story and could be a whole other wit talk in of itself. But because of that, I was going to the White House fairly regularly for meetings with White House officials and other government agencies about the Zika response because it was a whole of government response. So a particular meeting, which was, there was a DC snowstorm in January, government, everything shut down, but I still had to go to the White House Situation Room for a meeting. So literally, like I'm sitting, my boss, the Secretary of HHS is here, then Vice President Biden is here, and I'm like sitting behind them. The president is right here. So I'm literally in the Situation Room with I could have reached out and touched the vice president. My boss was in front of me. You have all of these senior level officials around the table, and that was like the coolest thing. And it was pretty funny after that meeting is Secretary Burwell turns around to me and she says, "Oh my goodness, I'm so sorry. I didn't think to introduce you." I was like, "It's okay," because I was just trying to keep it cool because I was so struck and overwhelmed by the fact that I was in this room at this high level meeting.
Can you describe a little bit more, like, some of your experience working with Elizabeth Warren? And, like, I know there was some criticism and things among, like, her presidential campaign, and how did you, like, handle that?
Yeah, so I would say, first of all, one thing I will say I'll say two things about Elizabeth Warren. One is, I'm a fairly active, I told you I'm a 40-something-year-old woman. Elizabeth Warren is in her 70s. I physically could not keep up with her. Like, she is, like, so much energy, like so much exuberance. So that's one thing I will say. She is a warm and kind person, and so I just have a number of stories just about her kindness gestures with individual staff, whether it's around a birthday, whether it's around the birth of a child, a loss in the family. As for me, as at the time a working mom, like having someone like that as my boss, who I could really talk to about considerations and things as a mom was incredible. The other thing I would say about Elizabeth Warren is the person you see like on TV and articulating these policies, that's who she is. She's not different when the cameras go off. So I think sometimes there are officials that are not authentic. She's incredibly authentic. And then in terms of your second question, how I handled the criticism, so the way that what I had to do as the chief of the staff, first of all, there are strict rules. This is true in the executive branch of government. This is true in the legislative branch of government. There's a firewall between what's called official activity, so what's happening in a congressional office, and what's happening in a campaign office. And the premise of that is you want to make sure that government resources are not being used to fund campaign activity. Now, in practice, as a chief of staff or somebody who's a higher level staffer in the office, there might be people that straddle the campaign and official site operations, but that needs to be done in a very prescribed way so that you're not violating, this issue of what money is being used for, right? So what I had to do as chief of staff is I had to make sure I was abreast and aware of what was happening with the campaign day to day. But my job really was to manage our office and to make sure that her 3 offices in DC, Springfield, Massachusetts, and Boston continue to run, continue to function, that Massachusetts constituents were getting what they needed. So what I wanted to make sure happened, and what I did make sure happened, was I tried to make sure that our staff were supported in what they were doing day to day. And I think to some extent we had to kind of tune out the, all the pundits and everything that was happening on the campaign side and focus on what our jobs were. And, my standard and barometer for success is I wanted to make sure that what we did in the Senate office was potentially a platform for her to run on, and a helpful foundation, and that we didn't do anything that would distract from the presidential race or make it harder for her in the race. So, I think, but again, going back to like the management and people, I think it was important, which I did, to try to acknowledge that we were in a period of uncertainty, right? And again, going back to what I said about transparency, here's what I can share with you. This is as far as I can go right now. I don't have a crystal ball. I don't know if she's going to get the Democratic nomination, for much of the fall. We didn't know she was going to be in it until Super Tuesday, right? But I think being clear about what we knew and what we didn't, and acknowledging that uncertainty is difficult, I think was important for me to do.
So I just want to thank you all for coming today. And Anne-Marie has offered her email if you want to catch that and ask her any further questions. You're free to stay back and ask her any other questions that you may have. She'll be here for the next at least 5 minutes.
Yeah.
But thank you all for coming.
Thank you.